Physical therapy is used to preserve, enhance, or restore movement and physical function that has been impaired or threatened by disease, injury, or disability. Physical therapy utilizes therapeutic exercise, physical modalities, assistive devices, and patient education to get people back to their lifestyle pain-free and with reduced risk for re-injury.
Physical therapy is the science of movement. So if there are things that you like to do in your everyday, whether it's walking or playing sports, and you're being prevented from doing those things, physical therapists are biomechanical experts in the science of movement. We do an assessment, we look at your movement patterns, and then we create a plan to help you get back to doing the things that you like to be doing.
There's times when you get little injuries or something that bothers you. You're like, oh, I could push it off. I don't need to get this checked out. And then it turns into something bigger. All right, now I need to look.
The doctor will send someone to physical therapy if they have muscle, joint, nerve pain or weakness, a post-op injury, dizziness or balance injuries.
I just find that when I did go to physical therapy, you just feel better.
Costs have been rising in the medical industry and in the practice of physical therapy. Some have turned to generalizing patient care instead of providing individualized care in order to cut costs.
Escalating costs in healthcare paired with reductions in reimbursements from insurance companies means the cost of doing business in healthcare is much higher, but the payments for providing that care are actually much lower. It's challenging for us to care for patients, marrying the business of healthcare with taking care of people and making sure that they get everything that they need within that time frame.
Everyone's body is different and everyone's going to respond differently to different exercises or modalities. Patients come in at different skill levels. They might have a goal to get back to walking around the block, where another patient might be wanting to run a marathon.
Medicine is supposed to be individualized care for you specifically, as opposed to if you have knee pain and someone else has knee pain, to assume that the treatment strategies to getting you back to doing what you want to be doing would be the same would be wrong.
You never really get good results when you do cookie cutters. It's always better to tailor things for certain people. They get the most out of it. It also shows the care. You actually care about this person and you want to figure out how they can improve.
It's addressing and looking at you as the individual. What are your goals? What would you like to be doing? And then what are the physical impairments that are keeping you from doing those things? By taking a better look at exactly your lifestyle and what your goals are individually, we can better create a more compliant plan where you're more educated and will hopefully get you back to doing things a little bit faster.
Physical therapy requires an investment of time, should be individualized so patients can return to pain-free life with the least amount of risk for injury. Davis Physical Therapy and Sports Rehab believes that providing the best patient care involves a collaborative process. Our team creates a professional and caring environment by actively listening to patients' needs and concerns. We establish a continuum of care that involves the patient's surgeon, doctor, athletic trainer, coach, and family in every step of the recovery process.
Davis Physical Therapy and Sports Rehab utilizes advanced technology and data application to create more efficient care plans. We've invested in different pieces of technology, data application, clinical research, and extremely experienced clinicians. We tie all of those things together to collaborate with the patients and get them back to doing the things they love.
We'll incorporate the surgeon, the physicians. If it's a student or an athlete, we'll incorporate the coach or the athletic trainer. So I'm not telling the patient, hey, you can't do this, and then their athletic trainers letting them re-injure themselves.
Once we go through our biomechanical assessments, we talk about what are the things that you want to be able to get back to doing, how to establish those goals, and we come up with a customized plan with appropriate frequency during the week, and then we get them hooked up with things at home. We create an accessible environment where we become the resource for them to better take care of themselves long term.
Davis Physical Therapy and Sports Rehab is using innovative technology to better identify and meet patients' medical needs. This technology produces data to quantify strength, power, and biomechanics, allowing us to create more effective treatment plans, getting patients back safer and faster.
We utilize technology mostly to help bridge the gap from what the patient understands to be true I'm moving and I feel better, so therefore I'm not hurt anymore. And what we know to be true, yes, you're moving, you feel better, and you don't have pain, but my goodness, your motion patterns are going to probably cause issues later on.
Technology really helps us to put a quantitative number on a visual deficit that we can see. Maybe how far their knee is collapsing and putting a number on it. And then developing a plan of care and having them come back in and retest is a really great way to show them that we're on the right track. If we're not on the right track, it's a really good way of catching it early so we can kind of regroup.
Being able to physically see the result of the testing and watch that arrow change from red to yellow to green is amazing. Like, it quantifies what you're doing in physical therapy.
The future of Davis Physical Therapy is bright. What we intend to do is provide high-level care that you only see at a professional athlete level, and we want to make it accessible for all. The use of technology and data application, we've been refining over the last couple of years to make it very systematic and easy to give the general public, high school athletes, older population, a much, much higher level of care.
If Andrea keeps doing what she's doing, the sky's the limit.
For more information, visit our website at davisptsr.com.